Hello, my name is Austin. I'm a nurse practitioner student at Henderson State, and today I'm going to be doing a neuro exam. So what we'll do is I'm going to wash my hands and we'll go ahead and get started. So first what I'm going to do is I'm going to test cranial nerve number 1, which is your nasal patency. So what I'll have you do is just take some good deep breaths in and out through your nose. Okay, and then we'll plug one side, same thing, and then the other. And then do you have a history of any broken nose or deviated septum or anything like that?
Deviated septum.
Okay, do you snore?
A little bit.
Okay. So cranial nerve number 2 is your visual, and so what I have is a chart here, and I'm just going to go ahead and use my cell phone. I have a chart on my cell phone. And so we're going to hold this about 4 inches, and I want you to read the 14 inches, and I want you to go ahead and read the lowest line that you can.
374258.
374258. And so what I'll do is I'll use this and I'll trace this over, and it looks like his vision is 20/30. Do you wear glasses or contacts?
I wear contacts.
And you have them in right now?
I do.
Okay. And so next will be the eye inspection. So normally I'm using otoscope. I don't have one. But when I'm doing that, I'm looking at the fundus, I'm looking at the margin and anything else there. Next would be his pupils. And so I've got my little pen light here. So I'll test one side and then the other, so just look straight out. Look up right. Okay. Okay, his pupils are perla. Next is eye movement. So what I'm going to do is I'm sitting in front of you, and I'm just going to have you follow my finger with both eyes. Perfect. Okay. And so next, what we'll do is I'm going to kind of test your sensation here. I'm going to use this Q-tip. Okay. And then last, I would check your corneal reflex. And so what I would do is I would have you look up and away, and I would touch just the outside of your cornea. We're not going to do that today. So next is the cranial nerve number 7. And so that's basically testing your facial muscles. And so what I'm going to have you do is raise your eyebrows like you're surprised, and lower like you're mad. Open your mouth real wide, and then puff your cheeks out. Okay. And then next is cranial nerve number 8, and so that'll be your hearing. So I'm just going to whisper.
1, 2, 3. ABC.
Okay. And then next is the voice, and so I'm kind of assessing this as we're talking. I can assess his voice because we're conversating. So go ahead and open up and say ah. Okay. And then we would now check your gag reflex. Again, I'm not going to do that today. So cranial nerve number 11. So what I'm going to have you do is shrug your shoulders, but I'm going to resist. And then what I'll have you do is we'll turn your head to one side and turn your head to the other, and I'll resist again. Okay. So the shoulders first. Okay. And then turn towards my hand. Okay. The other way. Perfect. And so now cranial nerve number 12, I'm looking at your facial symmetry. I'm making sure both sides are the same, and your tongue movement. So your tongue left and right and up and down. Perfect. Now coordination. So we'll start with the upper extremities, and so I'll have you kind of put your hands out just above your knees, and I'll have you go down and then turn your hands over and go down and then down. Yep, and then just quickly. Perfect. And then the lower extremities, the upper extremity. So take your hands, we'll kind of put them down by your side and bring it up, and then touch the tip of your nose. And then the other side. Excellent. Okay, now we'll move on to the lower extremities. And so what I'll have you do is I'm going to have you take your heel, and we're going to run it along basically the front of your shin, just like that. And then the other side. And then we'll have you kind of lift this foot up and then down and up as much as you can. And then up and then down. Perfect. So next we'll have is your gait, and so what I'll just have you do is I'm just gonna kind of walk from one side of the room to the other and then back. Perfect. Okay, now can you do that, but walk on your heels? So kind of like back on your heels, and that's kind of difficult. Okay, and then when you walk back this way on your tiptoes, see if you can walk on your tiptoes. Perfect, perfect. Now, can you stand in place and just give me a few just kind of light hops? Perfect, and then a few squats. Perfect. So next is gonna be the Romberg test. So what I'll have you do is I'm gonna have you stand here with your feet completely together. And you're gonna stand here with your arms down by your side and eyes closed. And I'm gonna watch if he's doing any swaying or anything like that for about 20 to 30 seconds. Okay? And so next we'll do the pronator test. And so what I'm gonna have you do is stand there with your arms, your palms up. And as you stand there, I'm just gonna slowly tap your arms down on both sides. Okay, so next is the motor. And so as he's sitting there and as he's standing now, you can go ahead and have a seat. I'm just gonna observe his positioning. Is he able to kind of keep himself upright? Is he slumped over to either side? Thing like that. I'm gonna observe any tremors. I don't see any. Next is muscle size and symmetry, and I can do that by just assessing. There's no obvious asymmetrical differences. Next is the ability stretch. So for this one, I'll have you kind of take your arm out, just kind of do some passive stretching, just your shoulder out as much as you can. You know, if anything, if it's painful anyway, just let me.
It's not.
And then we'll send up, and then we'll kind of do one of the like stretch like this. Like I said, if anything's painful, just let me know. Perfect, perfect. Okay. So next is going to be strength. So we'll start with the elbows. So I'll just have you put your arm out. And we'll kind of get, and then just use yourself. And then I'm gonna resist you, and I want you to lift up. Okay. And then we'll do the opposite down. Perfect. And the same thing on this side. We'll go just up and then down. Perfect. Perfect. So next will be the grip strength. So I'll just have you grab both fingers like that and just kind of squeeze and try to break my fingers. Give me what you got. Perfect. And then fingers, so just have you kind of put your arms out like this. I'm going to resist. You try to spread your fingers apart. Okay, and then turn your hands over. And I'm going to try to resist you bringing your thumb in. Perfect. So then we'll go to the lower extremities. So this will be the hips. So as you're sitting there, what I'm going to have you do is I'm going to have you try to bring your knees together. There you go. And then bring them, and then I'll have you try to bring them apart. Perfect. So the next will be the knees. So what I'll do here is I'm going to have you kind of try to kick your foot out and bring your leg straight. And then what I'll have you just have it straight and then try to bring it back. Same thing on this side. Okay. Back. Excellent. And so then we'll do the ankles. And so kind of the same thing. I'm just going to have you bring your foot up with resistance, and then I'll push it down with resistance. Okay. So up, down, okay, up, down. Perfect. Okay. So his grip strength is really great. It's 5 out of 5 on all areas. Next is going to be sensory. So what I'm going to do, we're going to do some touching in different areas, and I'm just going to describe it to me. So first we're going to do, if you kind of distinguishing the difference between like a dull touch and a sharp touch, and we're just going to touch different areas, okay? Yeah. And so we'll do all this with your eyes closed. So can you tell me if this is dull or sharp?
Dull. Sharp. Sharp. Dull.
Okay.
Sharp. Sharp.
Okay, good. So next will be temperature. And so obviously I wouldn't say this in front of the patient, but here I have this coin that I've kept in the freezer, so it's very cold. And so, Mr. Lester, if you'll just close your eyes and hold out your hand, I'm going to put something in your hand. I want you to tell me if it's hot or if it's cold.
Cold.
Cold. Okay. And then next is going to be a vibration. What we would use is a tuning fork. Don't have one of those today, so we'll skip that part of the assessment. Then proprioception. So what I'm going to do is have you hold out your hands, and you can do this with the feet as well. So what I'm going to do is I'm going to move one of your fingers in a direction, and I want you to just tell me which direction I moved it. Okay.
Up. Down. Up. Down. Up. Up.
Okay. And then finally, what we're going to get to is sensation. So I'm going to put a few different things in your hand, and I'd like for you to tell me what they are. Okay.
Coin. Quarter. Paper clip.
Okay. Then the other.
Sorry.
One more time.
Pen.
Okay. Perfect. So next what I'm going to do is I'm going to draw something on your palm, and then I'd like you to identify what it is. Okay.
8.
Okay. And then the other palm. Maybe like a letter.
Yeah.
A. Okay. Let me do it one more time.
Yeah. Yeah. A.
A. Okay. Perfect. And so next what we'll do is, like I said, do a little bit more touching, and I want you to identify, do you feel one touch or two touches, and then where you feel these, okay?
Okay.
Same thing, eyes closed.
The arm.
And how many are there?
2.
Two.
Yeah, my bicep.
And just one or two?
1.
One, okay.
1 on my leg. 2 on my leg.
Okay. And then last will be extinction. And so what I'm going to have you do is I'm going to have you close your eyes, of course. I'll touch an area, and then I'll, step away. I'll have you open your eyes back up and point to exactly where I touched you, okay? Okay, can you show that?
Right there.
Okay.
Right there.
Perfect. Okay, and then lastly, we'll do our deep tendon reflexes. And so normally what I would do is I would have a reflex hammer, and we're going to check the biceps tendon. And so what you do is you kind of have the patient position arm like this. You place your thumb over the biceps tendon, and you'll strike your thumb with a reflex hammer, causing his reflex to go up. And then we test it on the other side. The same thing. And then you would get that reflex. And then we'll do the knee reflex. And so we'll take our reflex hammer and we'll strike just below the patella on both sides, and that will elicit the knee reflex. And I think that pretty much concludes our assessment. Do you have any questions of me?
I don't.
All right, thank you for your time.
Thank you.